to be the government takeover of healthcare, because a lot of people are trying to say that the government's trying to take over healthcare, which is not true at all. There's no government takeover. It's not a government program. It's not going to be like Medicare, Medicaid. The reimbursements to the doctors in the hospitals have not been determined, so it's not like the doctors are only going to get paid the Medicaid rate or the Medicare rate, because none of that was established, because it isn't going to be a government program or a government plan. Tony?
Congress, they get to have their own thing. Why do they sort of separate themselves from us? And so I want to deal with the fact, and just to make sure you know, that in January 1, 2014, something very special is going to happen. And that is, your congressman has to buy their health insurance from the same place you do. I see that as the best protection I have and the best protection the American people have. If Congress has to go to the same pool as you do in order to purchase health insurance, I think that's important. So that's going to happen on January 1, 2014.
There was a woman next door who didn't have hair. She was being treated for breast cancer. She, because of this bill, and I'm going to show it to you folks, this is the bill that is so easily vilified because it is such a big bill. It's big. I'll just go on a tangent here. It's big because we have such a large and complex healthcare system that it takes a lot to try to address all of the problems that are wrong with it. That woman, because of this bill, will not have to worry that her insurance company will cancel her coverage because she might have forgotten to state or note on her application that she was treated for acne. Insurance companies cannot do that because that practice is now going to be illegal by this legislation. That small business owner, by the way, he and his wife had to get their coverage through the individual market. He had some heart trouble recently, and he has been able to get a policy through Blue Cross Blue Shield of Tennessee, but he and his wife paid $22,500 a year just for the policy. If they get sick, they will have to pay an additional, additional $14,000 in deductibles before the insurance company will pay anything for their medical care. Look, this is what is going on. These are the reasons why we have to have reform. All right, you shake your head. People, more than 40,000 Americans die every year because they don't have health insurance. Undoubtedly, a lot more die that we don't even have records for because they stop taking their medications. They can't afford to get their drugs. So you're going to get sick, and you're going to have an accident, and you are going to be facing bankruptcy as a consequence. This bill will change that. But if it didn't have this bill, think about what would happen to you all. Think about someone other than yourself. Think about your mom and your dad, or your son or daughter. That's why I ultimately quit my job, even though I knew that to a certain extent I was putting my family at risk. I could not continue to do what I was doing in good conscience because I saw what was happening to so many of our fellow citizens. This bill is not perfect. Absolutely not. I have not been an advocate of this bill or any kind of legislation. I have been an advocate, folks, of getting people the care that they need. Access to care, folks. That's why the other thing I have been advocating for is truth. And so much of my career, I hate to admit, has been around misinforming people and intentionally lying to folks and getting our politicians to lie for the insurance companies. And I did that expertly. I was able to do that expertly. And I have been so dismayed as I've seen so many political campaigns throughout the nation. I travel a lot. A lot of candidates are calling this a government takeover of the healthcare system. It is not, folks. It is not that. They have said this will put a bureaucrat between you and your doctor. It does not do that, folks. What you have now is a corporate executive like I used to be between you and your doctor and the ability to pay for it.